Avalide is a medication used to treat high blood pressure, hypertension. It helps prevent strokes, heart attacks, and kidney problems by lowering high blood pressure. Avalide contains two medications, Irbesartan and Hydrochlorothiazide. Irbesartan is an angiotensin receptor blocker, ARB, that relaxes blood vessels, making it easier for blood to flow. Hydrochlorothiazide is a water pill, diuretic, that increases urine production, helping the body get rid of extra salt and water. The recommended daily dosage and optimal timing for taking Avalide should be discussed with your healthcare provider. When taking Avalide, it's important to follow your doctor's instructions. Usually, it's taken once a day, either with or without food. If you find that you need to urinate more often after taking this medication, it's best to take it at least 4 hours before bedtime to avoid any disruptions to your sleep. If you're also taking certain drugs to lower your cholesterol, like cholestyramine or cholestyramine, make sure to take Avalide at least 4 hours before or 4 to 6 hours after these medications. The dosage of Avalide will be determined by your doctor based on your specific medical condition and how you respond to the treatment. To get the most benefit from Avalide, it's important to take it regularly at the same time each day, even if you're feeling well. Remember, many people with high blood pressure don't feel sick. If you have any concerns, or if you're not seeing any improvement in your condition, be sure to talk to your doctor. As your body gets used to the medication, you may experience dizziness, lightheadedness, or an upset stomach. If these effects persist or worsen, it's important to tell your doctor or pharmacist right away. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when transitioning from a sitting or lying position. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, this product may lead to dehydration and electrolyte imbalance. If you experience symptoms such as extreme thirst, very dry mouth, muscle cramps or weakness, fast, slow, or irregular heartbeat, or confusion, be sure to inform your doctor immediately. Additionally, serious side effects such as fainting, decrease in vision, eye pain, high potassium levels in the blood, or signs of kidney problems should be reported to your doctor right away. While it is rare, a very serious allergic reaction to this drug may occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a comprehensive list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other unusual effects. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. If you are pregnant or planning to become pregnant, it is important to avoid taking Avalide as it can cause serious harm to an unborn baby. It is important to use reliable forms of birth control while taking this medication to prevent pregnancy. If you think you may be pregnant, it is important to contact your doctor immediately. Before taking Avalide, it's important to let your doctor or pharmacist know if you are allergic to Irbesartan or Hydrochlorothiazide, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so be sure to talk to your pharmacist for more details. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have a history of gout, kidney disease, liver disease, lupus, dehydration, high levels of potassium in the blood, or skin cancer. Avalide may cause dizziness, and alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Limiting alcoholic beverages and discussing marijuana use with your doctor is also recommended. Prolonged sweating, diarrhea, or vomiting can increase the risk of lightheadedness or dehydration, so it's important to report these symptoms to your doctor. It's also important to drink plenty of fluids unless directed otherwise by your doctor. If you have diabetes, Avalide may affect your blood sugar levels. It's important to monitor your blood sugar regularly and share the results with your doctor, as they may need to adjust your diabetes medication, exercise program, or diet. This medication may also make you more sensitive to the sun and increase your risk for skin cancer, especially with long-term use. It's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. Any sunburn, skin blisters/redness, or new or changed moles/skin lesions should be reported to your doctor. Avalide may also affect your potassium levels. Before using potassium supplements or salt substitutes that contain potassium, it's important to consult your doctor or pharmacist. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Avalide, especially dizziness and changes in urine output. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about the risks and benefits of using Avalide, as this medication may harm an unborn baby. It's also important to consult your doctor before breastfeeding, as the effects of Avalide on breastfeeding infants are not fully known. Now let's talk about how to use Avalide and some precautions to keep in mind. First, let's discuss drug interactions. It's important to be aware that Avalide may interact with other medications, which can change how your medications work or increase your risk for serious side effects. Some products that may interact with Avalide include aliskiren, dofetilide, lithium, and drugs that may increase the level of potassium in the blood. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, some products have ingredients that could raise your blood pressure or worsen your heart failure. Be sure to tell your pharmacist what products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. It's also important to note that Avalide may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. Now, let's talk about the benefits of Avalide, the daily dosage, and the optimal timing for taking this medication. If someone has taken too much Avalide and experiences severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical assistance by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include severe dizziness and fainting. It is important to seek help right away in these situations. It is important not to share this medication with others. In addition to taking Avalide, making lifestyle changes such as participating in stress reduction programs, exercising, and making dietary changes may help increase the effectiveness of this medicine. It's important to talk to your doctor or pharmacist about any lifestyle changes that might benefit you. While taking Avalide, it is important to have lab and/or medical tests done, such as kidney function tests, potassium level tests, and skin exams. It's important to keep all medical and lab appointments and consult your doctor for more details. It's also important to regularly check your blood pressure while taking this medication. You should learn how to monitor your own blood pressure and share the results with your doctor. If you forget to take a dose of Avalide, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. When storing Avalide, make sure to keep it at room temperature and away from light and moisture. It's important not to store it in the bathroom and keep it out of reach of children and pets. When it comes to disposing of Avalide, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of Avalide. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.